This is a key decision of which direction to go in healthcare. You know, it's funny, at the healthcare summit, all the politicians of both parties agreed that we have the world's best healthcare system and that it's unsustainable. There's, what's wrong with this picture? I agree that it's unsustainable. Medicare is going bankrupt and so on. And so there are two fundamental directions to go. And this just was not discussed at the healthcare summit, but it is discussed by serious people on the left and on the right. There are two directions you can go. You can have top-down rationing from the government, or you can have people make informed choices where they share more of the costs of their own health care. That's the more market-oriented solution. And I think a key advantage of having people make their own decisions is that it is just not possible to process the information efficiently from Washington. You know, they're saying that in Washington they're going to reward doctors for quality. That's like saying that in Washington they're going to solve the problem of rewarding middle management by having middle management in every field send a report into Washington, and then Washington will use whatever theories of management to compensate middle managers. You cannot, at a long distance, evaluate the performance of something as complicated as middle management or as complicated as medicine. The people who are in a position to know whether a doctor is good or not are the people who are close to the doctor. The patients, the doctor's colleagues, and the doctor's supervisors if the doctor works for an HMO or a hospital. The idea that we can improve health care by evaluating people based on the forms they fill out is absurd. I can give you one example. A friend of mine received a Medicare bill for surgery, and she was quite sure that the doctor had not performed the surgery. So she calls Medicare and says, you know, I want to file, inform you that you were charged for surgery and that my doctor did not perform it. And the person at the other end of the phone said, no, I have the form right here. It says that the surgery was performed. That's what managing remotely from Washington looks like. It's not going to work.